Comprehensive NCLEX RN Practice Exam 15-2026. Question 1. What is the primary reason for administering morphine to a client with myocardial infarction? A. To sedate the client. B. To decrease the client's pain. C. To decrease the client's anxiety. D. To decrease oxygen demand on the client's heart. Morphine is a vasodilator that reduces preload and afterload, thereby decreasing the workload of the heart and its oxygen requirements. Question 2. Which of the following conditions is most commonly responsible for myocardial infarction? A. Aneurysm. B. Heart failure. C. Coronary artery thrombosis. D. Renal failure. The most common cause of ME is a blood clot, thrombus, that forms at the site of a ruptured atherosclerotic plaque in a coronary artery. Question 3. What supplemental medication is most frequently ordered in conjunction with furosemide, Lasix? A. Chloride. B. Digoxin. C. Potassium. D. Sodium. Furosemide is a loop diuretic that causes the kidneys to excrete potassium. Supplements are needed to prevent hypokalemia. Question 4. After myocardial infarction, serum glucose levels and free fatty acids are both increased. What type of physiologic changes are these? A. Electrophysiologic. B. Hematologic. C. Mechanical. D. Metabolic. Increased glucose and fatty acids are changes in the body's chemical processes and energy utilization, classifying them as metabolic. Question 5. Which of the following complications is indicated by a third heart sound, S3? A. Ventricular dilation. B. Systemic hypertension. C. Aortic valve malfunction. D. Increased atrial contractions. An S3 heart sound, ventricular gallop, often indicates fluid volume overload and ventricular dilation, common in heart failure. Question 6. After an anterior wall myocardial infarction, which of the following problems is indicated by auscultation of crackles in the lungs? A. Left-sided heart failure. B. Pulmonic valve malfunction. C. Right-sided heart failure. D. Tricuspid valve malfunction. Crackles in the lungs indicate pulmonary edema, which occurs when the left side of the heart fails to pump blood forward into the systemic circulation. Question 7. Which of the following diagnostic tools is most commonly used to determine the location of myocardial damage? A. Cardiac catheterization. B. Cardiac enzymes. C. Echocardiogram. D. Electrocardiogram. The 12-lead ECG is the standard tool for identifying which specific wall of the heart is damaged based on ST segment and T-wave changes. Question 8. What is the first intervention for a client experiencing myocardial infarction? A. Administer morphine. B. Administer oxygen. C. Administer sublingual nitroglycerin. D. Obtain an electrocardiogram. In the MONA protocol, morphine, oxygen, nitroglycerin, aspirin, providing supplemental oxygen is prioritized to increase the supply to the ischemic heart tissue. Question 9. What is the most appropriate nursing response to a myocardial infarction client who is fearful of dying? A. Tell me about your feelings right now. B. When the doctor arrives, everything will be fine. C. This is a bad situation, but you'll feel better soon. D. Please be assured we're doing everything we can to make you feel better. Therapeutic communication involves using open-ended questions to allow the client to express their fears and emotions. Question 10. Which of the following classes of medications protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation? A. Beta-adrenergic blockers. B. Calcium channel blockers. C. Narcotics. D. Nitrates. Beta blockers inhibit the effects of epinephrine and norepinephrine, decreasing the heart rate and contractility to protect the heart muscle. Question 11. What is the most common complication of a myocardial infarction? A. Cardiogenic shock. B. Heart failure. C. Arrhythmias. D. Pericarditis. Arrhythmias, particularly ventricular fibrillation, are the most frequent complication and the leading cause of death following NME. Question 12. With which of the following disorders is jugular vein distension most prominent? A. Abdominal aortic aneurysm. B. Heart failure. C. Myocardial infarction. D. Pneumothorax. JVD is a classic sign of right-sided heart failure, indicating that the heart is unable to accommodate the venous return. Question 13. What position should the nurse place the head of the bed in to obtain the most accurate reading of jugular vein distension? A. High Fowler's. B. Raised 10 degrees. C. Raised 30 degrees. D. Supine position. The standard position for assessing JVD is with the head of the bed elevated between 30 and 45 degrees. Question 14. Which of the following parameters should be checked before administering digoxin? A. Apical pulse. B. Blood pressure. C. Radial pulse. D. Respiratory rate. The nurse must auscultate the apical pulse for 1 full minute and withhold the dose if the heart rate is below 60 beats per minute. Question 15. Toxicity from which of the following medications may cause a client to see a green halo around lights? A. Digoxin. B. Furosemide. C. Metoprolol. D. Enalapril. Visual disturbances, such as seeing yellow or green halos or blurred vision, are classic clinical signs of digitalis toxicity. Question 16. Which of the following symptoms is most commonly associated with left-sided heart failure? A. Crackles. B. Arrhythmias. C. Hepatic engorgement. D. Hypotension. Left-sided failure leads to pulmonary congestion, causing fluid in the alveoli which manifests as crackles, growls. Question 17. In which of the following disorders would the nurse expect to assess sacral edema in bedridden client? A. DM. B. Pulmonary emboli. C. Renal failure. D. Right-sided heart failure. In right-sided heart failure, fluid backs up into the systemic circulation, causing edema in dependent areas such as the sacrum in bedridden patients. Question 18. Which of the following symptoms might a client with right-sided heart failure exhibit? A. Adequate urine output. B. Polyuria. C. Oliguria. D. Polydipsia. Oliguria occurs because the heart's failure to pump effectively leads to decreased blood flow to the kidneys, renal perfusion. Question 19. Which of the following classes of medications maximizes cardiac performance in clients with heart failure by increasing ventricular contractility? A. Beta-adrenergic blockers. B. Calcium channel blockers. C. Diuretics. D. Genotropic agents. Positive inotropic agents, like digoxin or dobutamine, increase the force of the heart's contractions. Question 20. Stimulation of the sympathetic nervous system produces which of the following responses? A. Bradycardia. B. Tachycardia. C. Hypotension. D. Decreased myocardial contractility. Sympathetic stimulation triggers the fight or flight response, which increases the heart rate, tachycardia. Question 21. Which of the following conditions is most closely associated with weight gain, nausea, and a decrease in urine output? A. Angina pectoris. B. Cardiomyopathy. C. Left-sided heart failure. D. Right-sided heart failure. Systemic symptoms like weight gain, edema, nausea, GI congestion, and decreased urine output, low renal perfusion, point to right-sided heart failure. Question 22. What is the most common cause of an abdominal aortic aneurysm? A. Atherosclerosis. B. DM. C. HPN. D. Syphilis. Atherosclerosis is the primary cause, as it weakens the arterial wall, allowing it to balloon out under pressure. Question 23. In which of the following areas is an abdominal aortic aneurysm most commonly located? A. Distal to the iliac arteries. B. Distal to the renal arteries. C. Adjacent to the aortic branch. D. Proximal to the renal arteries. Most abdominal aortic aneurysms occur infrarenally, meaning they are located below the point where the renal arteries branch off. Question 24. A pulsating abdominal mass usually indicates which of the following conditions? A. Abdominal aortic aneurysm. B. Enlarged spleen. C. Gastric distension. D. Gastritis. A visible or palpable pulsation in the abdomen is a hallmark physical finding of an AAA. Question 25. What is the most common symptom in a client with abdominal aortic aneurysm? A. Abdominal pain. B. Diaphoresis. C. Headache. D. Upper back pain. Abdominal or back pain is the most frequently reported symptom, though many aneurysms are asymptomatic until they expand or rupture. Question 26. Which of the following symptoms usually signifies rapid expansion and impending rupture of an abdominal aortic aneurysm? A. Abdominal pain. B. Absent pedal pulses. C. Angina. D. Lower back pain. Severe, sudden lower back pain often indicates that the aneurysm is stretching the arterial wall or leaking, signaling an emergency. Question 27. What is the definitive test used to diagnose an abdominal aortic aneurysm? A. Abdominal X-ray. B. Arteriogram. C. CT scan. D. Ultrasound. An arteriogram is the gold standard for definitive visualization of the size and anatomical location of an aneurysm before surgery. Question 28. Which of the following complications is of greatest concern when caring for a preoperative abdominal aneurysm client? A. HPN. B. Aneurysm rupture. C. Cardiac arrhythmias. D. Diminished pedal pulses. Rupture is the most life-threatening complication, leading to massive internal hemorrhage and rapid death. Question 29. Which of the following blood vessel layers may be damaged in a client with an aneurysm? A. Externa. B. Interna. C. Media. D. Interna and media. The tunica media is the middle layer responsible for the strength and elasticity of the vessel. Its breakdown leads to aneurysm formation. Question 30. When assessing a client for an abdominal aortic aneurysm, which area of the abdomen is most commonly palpated? A. Right upper quadrant. B. Directly over the umbilicus. C. Middle lower abdomen to the left of the midline. D. Midline lower abdomen to the right of the midline. The abdominal aorta runs slightly to the left of the midline, therefore, pulsations or masses are usually felt in that area.